But I think the broader point still stands, which is that consumers are now getting prescriptions on from everything from weight loss to hair loss to hormone therapies, sometimes paid through insurance, but often just paid out of pocket or through their HSA and FSA dollars. So, this direct to consumer relationship, Matt, I think poses a potential threat to traditional healthcare organizations like Duke Health. And, first because patients are able to get their prescriptions, online with that their healthcare provider isn't aware of. But second, because patients, may end up opting for more convenient online care in the future rather than going to a clinic. So I'm curious how you think about this evolution in the direct to consumer health. How do health systems remain relevant for all of the patient needs?
Oh, it's a wonderful question, and we do spend a fair amount of time thinking about these very things. I would argue that it's not really new or particularly even unique, given just the evolution of consumer-driven healthcare. For us, as a tertiary care or referral center, like so many across the country, we have a non-trivial number of patients that come to us for on-referral basis or for specialty care or procedural medicine and things like this, and their primary care might not be within our network. Very not uncommonly at all. And so we're accustomed to trying to understand the all the care that a person gives or receives, rather. So we're aware of medicines that they're taking, and we're in search of potential conflicting interactions and things like this. So the simple, if you allow that term, development of online tools and these convenience care programs isn't the start of this. The problem may be more prominent, though, and maybe even more threatening, but there are precedents for this, and what we can learn from these online and direct-to-consumer providers, not unlike what we learn from other industries, travel and hospitality and different things. We can learn from these convenience care, digital-first ecosystem providers things like convenience, things like experience, things like the personalization might be chief among them, personalization of the care itself. We should and can and do learn from their portal design, from the usability of their tools, how to provide access and grant access to the providers, lowering barriers to care. We in a specialty care facility oftentimes want to see the patients that we want to see. And perhaps we have some opportunity to open the top of the funnel a little bit. Based on a consumer-driven experience, it's also important to realize that when the care needs escalate beyond what Hims and Hers or beyond what an online tool can offer, there still needs to be a place like BMC or Duke Health or places that do offer the full portfolio of services and can take care of a person who has specialty needs, tertiary needs, quaternary needs. And so we certainly have a space. We have a place that won't go away, one hopes, and we have some responsibility to the patients that we serve.